Adenomyosis is probably kind of similar to endometriosis. So endometriosis is when this ectopic endometrial cells. So the word ectopic you've probably heard in the context of ectopic pregnancy. So ectopic just means that something that's supposed to be in one place ends up in another place. So ectopic cells, so the lining of the uterus or the endometrium, those cells end up in other places in the pelvis. That is called endometriosis. Sometimes it can be on the surface of the uterus or the ovaries or the surface of the pelvis. And then when it's actually in the muscle of the uterus, it's called adenomyosis. Sometimes adenomyosis can be what they call focal, which is where there's like kind of like pieces of it or chunks of it in certain spots in the actual muscle of the uterus. And then sometimes it's diffuse, which means it's just kind of scattered all throughout. Adenomyosis is very difficult to diagnose. And for years and years, people couldn't diagnose it because they didn't have any good tests for it. Because you actually need, it's not like when you look for endometriosis, you can see it. You sometimes can't see it by actually looking at the surface of the uterus, even during surgery. It's gotten better over the years. People can now diagnose it with sometimes with ultrasound or with MRI. You can see different kind of like suspicious regions that may look like adenomyosis. People with adenomyosis have pretty bad bleeding and pain with their periods. And it can be very hard for those patients. And it can also affect fertility because of the inflammation that is around these areas of adenomyosis. But the problem with adenomyosis, if there's like a focal big chunk of it somewhere, sometimes it can be removed, almost like how we would remove a uterine fibroid, like surgically. But they're very hard. I mean, it's very hard to remove them because they kind of invade into all the tissue around. So any sort of endometriosis or adenomyosis, it's suppressed by medications that make estrogen low. This is why we often would use things like birth control pills for suppression, or a medication called Lupron, or a medication called Digestin, like anything that kind of suppresses estrogen. One of the things that people have always kind of debated back and forth in our field is the role of medical suppression of either endometriosis or adenomyosis in the setting of doing treatment. But anytime you do an IVF cycle, what happens, right? Your estrogen goes way up. So it can be kind of an inflammatory state. And so sometimes either with endometriosis or with adenomyosis, if patients aren't getting pregnant, sometimes we'll try to do a cycle where we then freeze all the embryos or bank the embryos. And then we try to do something to kind of quiet down the adenomyosis or endometriosis. So sometimes that can be done with different types of medical suppression. Sometimes it can be birth control pills, Lupron. And the idea then is that if you get it all calmed down and suppressed, that maybe you will have a higher chance of getting pregnant if the embryo was then transferred right after the suppression. And again, that usually is done in the setting of a frozen embryo transfer cycle. We don't totally know exactly how endometriosis or adenomyosis affects success with infertility treatment, or how it affects infertility in general. Sometimes it has to do with inflammation and sort of how then the sperm and the eggs and implantation happens. Sometimes we think that it can affect the receptive window of the embryo. So anyways, these are all different theories, and we need to know more about endometriosis, and we really need to know more about adenomyosis. So it can be a real challenge. So I definitely talk with your clinician about that. We don't